Max, like most pugs, struggles with his breathing. He starts to actually wheeze now, or he gets raspy. I get really upset. I find it quite stressful. I mean, I'm worried he'll have a heart attack. I love him so much. He's just adorable.
Who's this, Max?
That's Max.
Hey, Max. I could hear you a mile away, mate. Hey, Max. How you doing? He's got what we call an elongated soft palate. It's a little dingly-dangly thing up the back of your throat. And it's too long, so every time he breathes in, it gets sucked into his voice box and not enough air gets through, so he makes a sort of sound. If we don't do something now, he will get laryngeal collapse or voice box collapse. And get to that point, there's not much we can do.
An operation is the pug's only chance of leading a happy, normal life.
Worst case scenario, I've seen dogs like this where we've ended up having to put permanent tracheostomies in them. Now, this is very much worst case scenario, and I guess I don't mean to scare you.
The tracheotomy, no, that's no life for a dog. I really hope that we don't have to go down that path. That would be horrible.
I know. It's not quite as nice as home, is it? Hey?
I'm trying to stay positive, but in the back of my mind, I'm worried about, I don't know, never seeing him again. That's also a possibility. Yeah. Oh, Max. You'll be a good boy.
Max is about to have surgery on his soft palate. Hopefully it will allow the pug to breathe normally once again.
If he doesn't get this surgery, he'll just basically have to sit in an air-conditioned room for a while and get taken out for little walks in the cool of the morning at night time, and then the rest of the time he just leads a sedate life. It's not much of a life for any dog, but pugs are, pretty vivacious. So this is his soft palate, or here. It just, when he breathes, it just gets sucked down into this airway here. So we're going to do a procedure which we call a snoroplasty, and that'll stop all that vibration when he's trying to breathe and run around.
Andrew Marchevsky is now using electrosurgery to tighten the lining of the soft palate. Often used in human operations, the electric current minimises bleeding.
And it's a crowded little area. He hasn't got a big mouth. No? So that's just the tip of his soft palate.
But Max's surgery is not over yet.
Max is going to get a bit of a nose job. It's not going to make him any prettier, but it's just going to make him a bit more functional. So we're just going to take a little wedge of tissue out of his cartilage in the nose, and having taken that out, then suture it. The surgery side of things is sort of the easiest part. The recovery is when I'm most tense.
Andrew will soon know whether Max needs to have his windpipe cut open and a permanent tube inserted.
You need to open your mouth as well, mate. You can't rely on just your nose.
He's trying.
Finally, the patient takes a much anticipated breath.
There you go, there's a better breath. Max was a little dog that was going to start having a lot of problems doing anything apart from sitting around getting fatter. Whereas now he'll be able to run around, exercise, just do normal things. I think his quality of life will be fantastic after this. Poke your tongue out at me. Come on, Max, you get you home. All right, I know. It's very exciting. It's very exciting, isn't it?
Max came into SASH gasping for breath. Now, after surgery, Andrew has restored his quality of life.
Can't wait. Yeah, I can't wait to see him.
But it will be several weeks before the swelling in his throat goes down, and Max can once again play with his 2-year-old buddy, Gaia.
Look, is that for Max?
Yeah, that's for Max.
That's for Max. Look at that, Max. You got a friend.
That's your little twin.
She is going to have to keep him quiet, and I think it's going to be a little nerve-wracking for her because she's protecting the surgery now.
Calm down. You're so excited.
He's so excited. Every time he makes a noise, she's going to go, is that right? So I expect she'll be on the phone to me in a little while, and that's fine. Bye.
It's a fantastic result. We're just really happy to have him home, the new and improved Maxie.
Going.
Hello.
Can I come straight through?
Yes, please, thank you.
Sarah and her daughter
Chris.
Poppy have rushed
yes,
7-year-old
Thanks, Sarah.
Hooligan in to see Chris after playtime turned to disaster.
It sounds really silly. We were playing a game of chase and we came round a corner together and we collided.
Okay.
She's immediately started crying and screaming and, you know, it was awful.
You can see she really doesn't like that.
Yeah.
It's my hand. It's all right.
We were having such fun.
Yeah.
One of her favourite games. It's all right, it's all right.
So what I'll do, I'll give her some pain relief, just so she's more relaxed and more comfortable.
Yeah.
And then I'll take an X-ray. It's almost like the family's never seen Hooli like this. Normally she is so full of energy and so full of life that to see her so withdrawn and in pain, it's really surprising them. And for them, they're finding it quite confronting. Got a surprise, didn't you? You thought play could be so painful.
Probably the worst case scenario is if it's broken. Hopefully just a dislocation and Chris will be able to just sort of, you know, pop it back in.
Got a feel for her. I mean, as a game, it seems so harmless and it sounds like they did it all the time, but it's not really what you expect when you come running around a corner to run into your owner.
X-ray.
Oh. Big fracture right across the middle there. That would be incredibly sore. That's not just one fracture, that's two. It's almost amazing she didn't hear a crack because that's what would have happened with these two. It would have been an absolute snap. So she actually does have a fracture here. So right through her radius and her ulna. What's hard about these types of fractures is they're not simple to fix. We're talking about serious orthopedic surgery.
Oh dear. It's all right.
Hooligan now needs to be transferred to SASH for a major operation.
Tomorrow really is the start of a very long battle for her because this isn't an easy operation. It's not something she's going to get over quickly. I'm going to make this a bit tighter. Okay. She's going to have to bring every little bit of courage that she's got to that surgery tomorrow, and really we just hope that she can pull through. It's a big day for her, so it's probably reasonable that she's a little bit anxious.
Hooligan has spent the night at the Bondi Clinic after a collision with her owner caused multiple leg fractures.
Oh, Angel, that's a wagging tail.
Owner Sarah and her daughter Poppy are now taking Hooligan to SASH for major orthopedic surgery.
Let's go.
She's a lovely dog, she's a very sweet dog, she's a very stoic dog as well, and she's going to need all that courage to get through today.
Thank you so much.
All the
Thanks,
best.
Chris.
No problem
Okay,
at all.
bye.
Take care. See you, Hooli.
All right.
At SASH, Sarah and Poppy are waiting for Andrew to view Hooligan's x-rays.
Ooh, that'd hurt a bit. The reason she's so sore is because the bone ends are still really close to each other and it's just grinding away, and that just hurts like hell.
I was awake a lot of the night worrying about my little one, reliving it all and, you know, just worrying, as you do.
I think what we need to do is put a plate on the bone, get the alignment perfect, and then it'll take probably the next 10 to 12 weeks to heal.
Okay.
Hooligan has never spent a night away from his family, and it's a tough goodbye for everyone.
absolutely awful, horrible. Hopefully it's just a clean break and it'll all be good and there's no nerve damage, and so hopefully it'll all be fine.
All right, darling, you ready? You'll be brave.
Andrew is about to start surgery on Hooligan's multiple leg fractures.
It's literally snapped in two, and the bone ends are totally separated.
Andrew will now insert a permanent plate to rejoin the bones.
And so the plate will be there like an internal splint. The most important screws are the first two or three. If the first couple of screws aren't quite right, then there's a domino effect and they get sort of worse and worse as you go. Right, there we go. Let's give it a bit of a flush and close it up. Ah, that looks pretty good. I'm really happy that it just couldn't look any better. She's going to think it was never broken, but if she suddenly takes off and chases after something, she could pull those screws out, bend the plate, do horrible things. So she's going to be confined to leashed walks and no chases for the next 2 or 3 months.
It's all right. It's okay.
As soon as Hooligan wakes up,
She's very brave.
Very brave.
Sarah and daughters Poppy and Charlotte are allowed in to see the patient.
Quite amazing. She was really quite stirred up when they're not here, but as soon as they get here, she just becomes this totally contented little critter.
It's just good it's all over and it went well, and it was so nice to see her again.
We could see as soon as they put her back in the cage and started walking away, she started crying and getting upset again. She's very bonded to the family, it's obvious. So there's a lot of loving there.
Should be right.
Hooligan! Hooligan! Are you feeling better? Yeah?
It's just one day after Hooligan's major operation
You're gonna
to
be
fix 2 fractures in his leg. He desperately wants to go home, but first
what
he
you
has
can
to
do.
pass Andrew's test.
You're feeling better? Come on, we'll see what you can do. Right, come here. Come on, Hooligan, there you go. It's sort of a case of what broken leg, isn't it? She's walking around like there's no problem at all. They don't improve any quicker than she has.
It's an A+ for Hooligan, and his elated family can't believe their luck.
Hello, little one. Look at you. Didn't even bring a lead because we just didn't imagine that she'd be walking like that.
She's doing obviously great,
Yeah.
but you're going to have to be... She thinks she's fixed. She's
Yeah.
not fixed. I mean, it is great, but it sort of does create other problems in
Yeah.
the sense that she's just going to have nothing to tell her to slow down except you guys. So.
Okay, we'll do that. Yes, we will. That was amazing to see her walking out. That was fantastic.